My name is Elizabeth Jones. My presentation is on the culture of the Jehovah's Witness religion. The beliefs of the Jehovah's Witness culture is that they do not accept any blood products. This can be challenging for medical staff caring for them, and my presentation is to help us better understand and handle these situations. Jehovah's Witness is a religious organization that has been controlled by the Watchtower Bible Tract Society since 1945. They teach that the biblical commands, you must not eat blood or abstain from blood, means that taking blood into your bodies in any form is prohibited, even in medical use. As nurses, we are likely to encounter patients who refuse whole blood, packed red blood cells, plasma, platelets, and other therapies containing blood products. Jehovah's Witnesses also refuse preoperative autologous blood donation. Most Jehovah's Witnesses will not accept blood products, but they will accept blood-conserving methods such as controlled hypotensive, most diagnostic and therapeutic procedures, non-blood volume expanders, pharmacological agents that do not contain blood components or fractions. Why might a transfusion be needed? To increase red blood cells, therefore increasing oxygen circulating in your blood to support body functions, to replace clotting factors or platelets in your blood to help stop bleeding, to replace blood loss due to trauma or injury, or to replace blood loss resulting from treatment or procedures that may cause your blood cells to be lower for a time. Most people refuse blood transfusions for religious beliefs or spiritual beliefs or just individual preferences. Having patients that refuse receiving blood products can cause ethical dilemmas within the medical staff caring for them. Ethical dilemmas occur when there are equal reasons to support or oppose a particular course of treatment. Ethical dilemmas can be made resulting in neither choice being a right or wrong decision. Ethical dilemmas may arise from medical staff when they have a competent patient who is refusing blood transfusions or treatment. Ethical dilemmas may become even more difficult when the patient is incompetent or a child is involved. There are many reasons that people support the refusal of administering blood products by healthcare workers on behalf of a competent patient making an informed choice, which include choice, dignity, justice, and advocacy. Choice: the nurse must respect and promote the autonomy of the patient. Dignity: the nurse must be sensitive to an individual's needs, values, and choices. Justice: part of providing justice in nursing care is putting forward and advocating for the interests of all persons in their care. This means providing health care to the needs and wants of the informed patient. Advocacy means supporting, protecting, and safeguarding a client's rights and interests. Advocacy is undertaking the best interests of your client. Many people who refuse blood products have advanced directives. They also may carry a no blood card in their wallet. These cards can have some controversy. The card is intended to document the Jehovah's Witness informed refusal of blood in the event of an emergency. This card has been questioned, particularly when a Jehovah's Witness patient presents unconscious and bleeding, with the blood card being the only expression of will. There are also people who oppose the patient to refuse blood products. Some people feel that they are going against what they vow to do to provide the best care possible and advocate saving lives if they don't transfuse blood to a patient who needs it. Many people also have a hard time with blood refusals when minor children or pregnant women are involved. The Committee of Bioethics of American Academy of Pediatrics says that children of Jehovah's Witness parents should be given treatment independently from their parents, that children should not be harmed through religious practices. There are alternatives. Certain disorders can be treated with some medications like iron therapy, vitamin B12, folic acid. There are lots of things that can be used during surgical procedures, such as volume expanders. They can use hypertensive anesthesia. They can try to lower your body temperature so that you decrease the oxygen consumption. Such things as cell saver devices. They can also try to do surgery through endoscopic or laparoscopic so that there's a smaller incision, and which decreases the potential for blood loss. More hospitals and doctors are also trying to use bloodless medicine in surgeries. They're using new and existing techniques and procedures which help with reducing or eliminating the need to use blood. What are some of our challenges as the medical staff? How do we respect the wishes of Jehovah's Witness families and protect the lives of our non-adult patients? We must be honest and straightforward about our policies and practices with these patients. Things that nurses must keep in mind is that blood is not always needed. We must remember that transfusions carry risks as well as benefits. We must seek to understand our patients and develop a good rapport with them. We must also access available resources for them. When taking care of Jehovah's Witness patients, we must limit blood draws, consider alternatives to blood products, explore treatment possibilities, ensure confidentiality, document carefully, and consider another plan in advance in case the plan that you have in order doesn't work out. Other things that nurses must do is to respect the patient's individual choices. We must practice in coordination with our nurse's scope of practice. We must obtain informed consent prior to any procedure or treatment. We must be trustworthy and advocate on behalf of our patients' wishes. As nurses, we also must consider that the quality of life is subjective. It is what our patients say it is for them. We must consider the value of the patients and their relatives and know that the healthcare staff and the value that they hold may differ from person to person. We must encourage fair, non-judgmental decisions, and we must know our facility's policy. There are some conversational strategies that we can use with Jehovah's Witness family and patients. We have to avoid rushing. We must listen to them and listen to their families. We must listen even when in an emergent situation and time is of the essence. We can also get the Jehovah's Witness hospital liaison, if we have one available, that will help provide support for the patient and the family. Last but not least, we must respect our clients. According to our textbook, spiritual nursing care is assisting the client in integrating their own beliefs about a supreme being or underlying truth. Spiritual nursing care promotes clients' physical and spiritual health. Nurses must remember the goal is not to impose our own beliefs and convictions on our patients, but to listen to what they have to say and support and respect them in it, even when we don't agree.